Hi, I'm Dr. Jamil Sayed, and on this podcast, we're going to talk about some deep stuff. I'm here to tell you that you're amazing, and often, the only person who can't see that is you. No matter who you are, what you do, or where you're from, there's greatness in you. Let's talk about it. Hey everyone, I'm Dr. Jamil Sayed, and welcome to the Transformation Starts Today podcast, where I interview leaders, champions, and high performers from all walks of life as they share their stories, the lessons they've learned along the way, and empowering perspectives to help you create an extraordinary life without regret starting today. Today we have Dr. Hal Blatman with us. Dr. Blatman is the founder and medical director of the Blatman Health and Wellness Center and a nationally recognized specialist in treating myofascial pain. He is credentialed in pain management and board certified in occupational and environmental medicine and in integrative holistic medicine. For several years, Dr. Blatman practiced family medicine while managing a chain of urgent care facilities. During his tenure in general medicine, he recognized Western medicine's difficulty treating and managing chronic and myofascial pain. In 1988, Dr. Blatman established Cincinnati's first clinic specifically dedicated to providing traditional and holistic pain treatment solutions. Dr. Blatman, it is a pleasure to have you here. Welcome to the show.
Thank you so much. What a pleasure to be here and to talk to another kindred soul.
Thank you so much. How are you feeling today?
I'm doing well, thanks. Yeah, it's
Wonderful.
been a good day.
Yeah, and so to give some context to our conversation for the listeners, Dr. Blatman and I had the pleasure of meeting probably about 5 or 6 years ago for the first time. I was in Arizona. I was a student at the time, and he was giving this beautiful presentation on treating pain at this health conference I went to, and it was just so captivating. I remember walking up to you after and just, giving you some congratulations on what an amazing presentation, but also just wanting to get in contact, and we've had some phone calls since, and it has just been so wonderful to see an alternative approach to pain that really, really works.
Yes, you found out in your career that medicine is not what we were taught, right?
Yeah.
And I found out that pain is not at all what we were taught. The model that we were taught about just doesn't work. And that's why so many people walk around still with pain that's so chronic. And we don't think it can go away. We don't think we can help them. And the only thing we have is pharmaceutical agents, pain drugs, drugs that change the mind, make the mind not work, make the brain not work, foil the mechanism of how pain gets transmitted. And we also think that pain comes from nerves. So we have a lot of treatments that kill nerves, and the pain doesn't come from the nerve. It doesn't come from the disc. It doesn't come from the spine. It doesn't come from the joint. So there's so much that we got it wrong. We really missed. And what we do and what we've learned is right or works well enough once in a while that we keep doing it. And we don't stop and think, well, what else is in here?
Yeah, that's something that I'm so excited for today, because so many of our listeners either themselves or they know someone in their personal life who's probably in a fair amount of pain, probably on some type of medication for pain, some type of treatment, whether it's a joint pain, like you said, or it's some type of inflammatory thing going on in their body, whatever it is. This will be a very relevant conversation. And so for our listeners who don't know you yet, they haven't heard your story, I have found that each of us is the hero of our own story. We've experienced challenges, setbacks, and adversities that we've overcome to get to where we are today. And so I'd love to hear, and I'd love you to share with our audience, what is that hero's journey that has led you to what you do today?
Oh, wow. I had so many twists and so many turns in my journey, but if I go too long and it gets boring, please let me know and I'll try to shorten it. But my parents always had me aware of integrative or holistic things, because whenever we got sick, we were pounding vitamin C. There's a lot of things that we didn't do quite right, but at least I got the idea that vitamins might be important in my life, and I saw my illnesses go away faster. I went to medical school, and I loved orthopedic surgery. So I started in orthopedics, actually. I had my fingers in most every joint. I learned how to feel the tissue. I learned what was inside. Just regular old orthopedic surgery in the level 1 trauma center. It's where I did my first 2 years of training. I found that there was more to life than orthopedic surgery. One of my favorite things to do was to put fingers back on when people got them cut off. And I was, we do the hand washing, scrubbing thing before you walk into the OR about 3 o'clock in the morning. And the head of the department, who was my mentor at the time, said, Hal, I'm so depressed. My 6-year-old told me that she knew I was home the other night because the toilet seat was up. And that was kind of the end of my orthopedics. I didn't want to do that in my life. I missed a lot. I did a lot of things that missed the family life, but I didn't want to be in the hospital doing that. So I left orthopedics. I started working for an urgent care office, and within a couple of months, a dentist walked in and asked me if I'd ever heard of TMJ syndrome. Well, this was many years ago, and nobody had heard of TMJ syndrome. And he was the newly found expert in town. He began to show me how to put my fingers into somebody's mouth and touch things in their neck and find out that pain was not what I was taught. It was coming from these tender structures. And so I never looked at headache the same way again. And I started to send all these patients to him. Well, as the years went by, I ended up getting a monograph by a medical director in an urgent care center that was written by Dr. Janet Travell, 33 or 4 pages long, basically summed up what is fascia, what is pain, where are trigger points, what are pain patterns, and that sort of stuff. And I was working in an urgent care center on a Sunday morning, and this woman came in with pelvic pain. And I was 20 years her junior. I looked like Dookie Howser. And her physical exam said pelvic inflammatory disease, intravenous antibiotics, pelvic exam, ambulance ride to the hospital. But her story didn't fit that. And I offered, instead of a pelvic exam and intravenous antibiotics and all those things, I said, how about if we just stretch out the muscles in your belly and see what happens? Well, looking like Dookie Howser and being 20 years her junior, I didn't have to invite her twice. And I got the monograph, I laid it out on the counter, and I laid her on the exam table. And I, did what the diagrams in the monograph said. In about 5 minutes, all of her pain was gone. And this incredibly tender abdomen was also totally benign. So now it was my turn to adjust my overalls and try to figure out what I had done. I got permission to call her back in a week, and I've gotten to the point where I don't believe anything I can't see, touch, feel. And I found I can see, touch, and feel a lot, but I need to see, touch, and feel it. And so I called her up in a week to see if the pain was gone. The pain was still gone. So I read the rest of the article. And the clinic I was working in pretty much full time humored me. They bought me all the tools of the trade, dental syringes, dental needles, fluoromethane. And I followed this 34-page monograph and started to go to work. And I basically taught myself the field of myofascial pain in the next year while I was working in this urgent care center. And at the same time, I was a resident. I'd gone back to school. I was now a resident in occupational environmental medicine, clinical toxicology, and ergonomics. So as I was going through those 2 years, I built up this skill set. And this clinic that was, closed at 10 was now sending the last person out the door at midnight. Nobody complained, and everybody was getting a level of care that they'd never seen before for pain. And at the end of my occupational medicine training, I opened up a practice in 1988 just to treat myofascial pain. And so now this is, 13,000 patients later.
Wow.
And so we've learned a lot. We've evolved the work that Dr. Travell started. And now I do this in 2 cities. I have my main operation in Cincinnati, Ohio, and I have a satellite office in Manhattan, right in the middle of kind of the Upper East Side from Midtown.
Yeah.
And I did that because my younger son said, Dad, if you really want to change medicine, and I was the president of the American Holistic Medical Association for a couple of years. And my drive has always been, let's see what we can change and make this better. And he said, if you really want to change medicine, you're not going to do it in Cincinnati. You're going to have to be here in New York. And one thing led to another, and I opened a practice in Manhattan. And it took a year off with COVID, but we're back. We're there every Thursday and Friday, and just doing amazing, amazing things. And after I opened the practice a couple years later, dentists have catalyzed my career. I don't know how that alignment has happened, but it has been amazing. And a dentist called me up in the early 1990s, told me that he was working on this particular patient's head and neck and TMJ pain, and I'm working on her neck and shoulder pain. It was a workers' comp injury, and we should get together and collaborate. So we get together, we collaborate. And I find out that he's no beginner. He has Janet Travell's book signed by Dr. Janet Travell.
Mm.
And he finds out that I'm no beginner either. I have this history of understanding TMJ syndrome and head and neck pain. And so we had one of those conversations. Is she still alive? How do I find her? And he said, you're in luck. There's a course by invitation only in 6 weeks, and I think I can get you in. And 6 weeks later, he and I flew to Bethesda, Maryland, and I had my first weekend with Dr. Janet Travell. And it was an amazing transformation because, I'd taught myself this field and I thought I knew what I was doing. And I came back knowing a whole lot more. And just her mentorship was just amazingly helpful. So that what got me my start. And as things moved on, it got to intravenous vitamins. It got to all the other things that we do that, we were never taught would work. We were taught to ignore them. Why do you need vitamins? And, you need vitamins because it's not in your food. And why do you need intravenous? Well, because your gut doesn't absorb so well because of all the injuries through your lifetime that you've done by the food that you've been eating. So it's been a wild ride. It's been amazing. I have been able to take advantage of some wonderful gifts that I can use to help people. And so I just enjoy every day bringing this to the world, because you don't have to suffer. You don't have to stay in pain. You can make it go away, and you don't need to have it. But what you're doing in the pain center is, the reason it's not helping is because it doesn't work. And the reason it only helps temporarily is because it's not the right idea. So that's what we've gotten to.
Thank you for sharing that. And one of the things that stood out to me in your story that I think can relate to everybody, regardless of their profession, what they do in life. So there you were in the hospital, you were scrubbing in, you were washing your hands, and that other, physician made that comment about the toilet seat being up, and that's why his kid knew he was home. And then you realized, I don't want that kind of life.
Right.
And then so you shifted, and here you are right now, when we first started our conversation, asking you how you're doing, it's like, I'm doing really well. Every day is exciting. I'm doing, like, you help so many people. There's a smile on your face, like the whole time you speak. And it's this idea of, okay, whoever's listening right now, maybe you're in a position where you feel that you don't really love what you're doing, and that you see people further along the journey than you, that you're kind of going in their footsteps, you're following them, and you see the life they're living and you don't want that. And if you realize, okay, what would happen if I pivoted right here? I don't know the full story. It's like the mind can really latch onto what it's going to lose. It has a harder time latching onto what it might gain, because what it might gain is kind of theoretical. What it's going to lose kind of feels more concrete. But the thing is, if you know that you don't like where you're at, then the guarantee I can give you is if you stay, it's going to be more of the same and it might get worse. But if you shift into something that could potentially be great for you because it's exciting you and it seems better than what you've got now, it's probably going to be a good move in the grand scheme of things. Because again, at the end of the day, at least in my experience, that happiness, that fulfillment, just like part of the basis of this podcast, to create an extraordinary life without regret. I don't think you'd like to get to the end of your life, whenever that is, and realize there's a book. Who was the author? It's Ivan Illich is not the author. His name is the character, but it's an old school book. Whoever it was by, one of those famous, I think it was Tolstoy or Dostoevsky, one of the two. But the idea, though, he's on his deathbed and he says to the guy next to him, "What if my entire life was wrong?" It's like he's on his deathbed, he's looking back on his life, and he's just realizing with regret, did I mess things up? What if I didn't live the life that was true to me? And if you think about the top 5 regrets of the dying, there's a book with that same title. The number 1 is, I wished I lived a life true to myself, not the life other people expected of me. Right. And if we come from that headspace of, I don't know everything, but I know right now that I'm not happy. I know right now that I don't like the direction this seems to be going in. I see all the people around me doing similar things. I don't want that kind of life. And then now that awareness, that realization is the gift that you can now use to give yourself a new trajectory, but you're going to have to take new action. And I've done that. Dr. Blatman has done that in his story. And I don't know anyone who's done that that regrets it.
Yes. Well, some people that get a divorce and get a new relationship live to regret it.
Mm,
So we have seen that, and I'm sure you've had friends that have been that. But when we're talking about careers, you're absolutely right. You know, my father, I watched him change careers when he wasn't happy. And I'm actually in my fourth career since medical school.
that's
You
really
think
cool.
about it. I started in orthopedic surgery, then I was an urgent care doc, then I was an occupational medicine doctor, and now I'm kind of a healer. You know, I focus on pain, but you know, we do three things in our office. One is we've learned a paradigm to understand pain where most pain can go away. And we've coined 5 rules to understand pain. We'll talk about in a little while. So our wheelhouse first became pain, and then it became regenerative medicine. We've been using stem cells and platelet-rich plasma in our office for more than 25 years. That's a long time. And so we can grow new cartilage in a worn out joint. You can grow a new rotator cuff tendon. You can heal your brain from dementia. You can heal your heart, sometimes from heart failure. You can regrow nerves and blood vessels in your private parts to make them work better again. There's so much we can do with that. And then the third thing was, as you learn more and as you get a bigger picture of how the body is put together, and you begin to understand how we lose resilience, how we fall apart, how disease happens, and you start to understand how does a body put itself back together? What does it need to do that? And how do you facilitate that? Now there's a whole world at your disposal. So Lyme, mold, chronic fatigue, fibromyalgia, cancer, Ehlers-Danlos syndrome, all these things that conventional medicine really doesn't have anything to do, doesn't have a way to help with those things. It all becomes so similar because we all fall apart the same way, no matter what the disease is. They're just little nuances that need to be changed and need to be different.
Mm. I'm excited to dive in. So, Dr. Blatman, when you think about a person experiencing physical pain, what comes to mind for you? You know, what does pain represent?
Pain represents the injuries through our lifetime, emotional, spiritual, mental, but mostly physical. We've been injured in our bodies since birth, and we have multiple injuries through our bodies since birth. And those injuries count bigger than we thought. For example, a lot of lower back pain. You complain of pain in your lower back, but the reason your treatment isn't working is because the pain you feel is in your lower back isn't coming from your lower back. It's coming from injuries that started when you were a child. How do you get those injuries? You know, the human body, there's 2 things we cannot defend well. One thing is bullheadedness that women call stupidity, mostly because it's men doing it. And that's the guy who's way too old, curling way too much weight, doing way too many reps, and he shreds his biceps and wears it like Popeye in his arm. And we've all seen 1 or 2 people like that. The other thing we can't defend is impact. If you put pressure on fascia, you can pull with a lot of force and it'll hold. But if you go with impact, you fail very, very quickly. So how do we injure our body? Well, we jumped out of trees. We jumped down the steps. We jumped out of the swing set. And many of us, you would be amazed how many people remember we jumped off the roof. You either led or you followed, or you watched. And most of us followed, and some of us led, and a few of us watched. But when we landed, we tore our legs, we tore our hip tendons, we tore all these things that some of us, they healed and they did well. But others of us, as our tissue got less resilient as we got older, now it turns into chronic pain. And those are the injuries that are making what we call sciatica. That pain and numbness that goes down your leg is rarely coming from your lower back and almost has nothing to do with your disc. We were taught in orthopedic surgery and in all of medicine, if you can show a problem on the X-ray or MRI scan close to where the pain is, then you can tell the patient that the pain comes from what you see on the X-ray or MRI scan. And that belongs in the horse poop drawer. It's just not true. It's true sometimes, if the bone is broken, that's not too hard to put two and two together. But to say that the disc is causing the pain that goes down the leg requires a leap of faith we have no right to make. And so enough people get better doing the surgeries and doing what we do, but that we keep on doing it and we keep thinking it's the right idea, but overall, it's not. And the reason people come back to have that epidural steroid done again is because it didn't solve the problem. And it's not the root cause of the pain. The root cause of the pain are the injuries through your lifetime, compounded with what happens to your fascia when your immune system interacts with the food you've eaten, the environment you live in, the air you breathe, and the poisons you put in your body that you do or don't know about.
So for the people who aren't familiar with some of the medical terms, could you describe, what is fascia and what role does that play in pain, since this is the topic of today?
So if you have a steak, an ordinary steak on the plate in front of you, instead of cooking it and cutting it and eating it, you grab it by the edges and pull it apart. If you have a microscope, you'll see a thin film around every muscle cell, around every muscle fiber. But with your naked eye, you can see the film that goes around the steak and through it to hold it together. And it comes to form the gristle that we also call tendon at the end. And we're taught that tendons attach to bone, and they don't. The strings that go through and hold the muscle together interweave with the strings that cover the bone, and then they continue in the next muscle. And you're one string from head to toe, and you can feel it real easily. Let me show you an example that everybody can do. You can take this muscle in your neck, this big, thick muscle, and get a big grip around it.
And just real quick, for people who are only listening and not on video, this is called like the sternocleidomastoid.
Sternocleidomastoid muscle.
It's
correct.
back of the ear down to like the clavicle area. And it's kind of like that muscle that really sticks out in the mirror. You could see it if you're pushing against it.
And you get your thumb and your index finger around this muscle and bring your thumb across it. You can feel ropes and cords in this muscle that between the back of your head, behind your ear, and down on your collarbone are impressively tender in some places. And everybody can feel that tenderness. And everybody's got that injury. And then if you take your finger and you touch the top of your collarbone, push in on your neck and go across the bottom, you'll feel little irregularities that are also surprisingly tender. Got that?
Mm-hmm.
Well, this tenderness on your clavicle is the injury that causes the kinks in that muscle in your neck. And the first time you got that injury, you were an infant, and somebody picked you up by your shoulders, forgot to bring your head. Another time that happened, you were in the playground, and some little kid came up behind you, shoved you to the ground, snapped your head back, and tore where the strings and cords that go through the sternocleidomastoid muscle and hold it together weave through the cover over your collarbone before they come down into your chest. Take your fingers and get a big bite of your pec muscle and run your thumb across that, and you'll feel cords and real tender areas in that muscle also, right?
Mm-hmm.
Well, that happened when you got up off the playground floor and pushed that little kid back. Or maybe when you did too many push-ups in high school to win the Presidential Fitness Award. But these are the injuries through your lifetime. Another one, the top of your shoulders has that thick muscle that we call the upper trap.
Mm-hmm.
And that, in most people, you wrap your fingers around it, it's tender. And you can feel the cords and ropes in that too. Same cause. You're strong enough to contract your upper trapezius muscle to lift and carry your book bag, your briefcase, your suitcase, and hold up the world, because you're an adult and that's what we do, right?
Mm.
But where the muscle anchors to hold you together peripherally and centrally isn't strong enough to hold you together when you pull that hard and you tear from both ends and twist into these kinks, just like you twisted into that one. And those injuries are the pain that we eventually have through our lifetime. Have you ever noticed that men lose their butt muscle as they get older? Talk to women,
yeah.
they notice that. And the reason for that is your body will not allow you to get strong enough to tear yourself apart from the inside.
Mm.
So as you lose resilience in the tendons and structures that hold your butt muscle to your body atrophies the muscle, so it's not strong enough to tear itself apart.
Wow. Yeah, it's just a protection mechanism.
And if you regrow those tendons and you make them stronger, that those injuries came from childhood and jumping out of trees, you can grow a butt muscle back again. And your body will do that naturally just by strengthening the tissue.
It's so amazing. I found, even though we do different but similar work, both in that healer kind of capacity, seeing people and experiencing and helping them experience that so much of their current pain right now, I do more of the mental and emotional side of things, but so much of the pain that they're dealing with now stems from various points in their life, traumatic experiences, repressed emotions, all these kind of things. And it's like you said, just like, the person lifted you up by the shoulders and your head kind of snapped back a little bit and there's an injury there. In the same way, something happened when you were 4 and that was perceived as a trauma and you made it mean something about you and like that you weren't good enough or something, and you've run your whole life with that in the subconscious. And so, some people might be listening and thinking, well, I'm 30, I'm 50, I'm 70, can't really do much about me being, maybe jumped off a house when I was 6 or 12. What are some things that people can do that might be preventative? I get, even in the word, it's already kind of happened, but what can people do that might be preventative to any additional damage and pain? And what can people do that might be really serving? Maybe there's some exercises, or is there anything they can do prior to if they had to come and see you with like an injection or something like that?
It might be better to talk about the 5 rules first, because that'll put it
Please.
in
Yeah,
perspective.
let's do
And
that.
but before we get to that, take a look at this diagram. This is the injury you felt in your collarbone. This is the injury on the other end of the muscle in the back of your head that the neurologist is going to call occipital neuralgia.
So
These
real quick,
axes,
for people who are listening, can you just describe it so like the pain would be, let's say, around the eye, but it's actually stemming from the neck?
these
Yeah.
kinks in the sternocleidomastoid muscle that we just pointed out make this pain that goes across the forehead and across the face that we call migraine and trigeminal neuralgia.
Yeah.
So the 5 rules. Rule number 1, and see if you agree with these, because as I take them around, they have stood the test of time. So let's see what you think. Rule number 1, you can't believe that pain comes from where you feel it. Your headache doesn't come from your head, doesn't come from your blood vessels, doesn't come from your nerves. The pain in your left arm could be your heart attack. Don't they teach us that? And talk to your friends who've had their knee replaced, especially the older ones, and how many of them the knee still hurts and the pain never came from the joint. Rule number 2, contrary to what we've been taught at our core, your brain can't tell the difference between numbness, tingling, burning, itch, tickle, sharp, dull, achy, stabbing, and even sexual arousal come from the same nerves, the same skin, and go to the same part of your brain. And the differences of those sensations are not in any way diagnostic. Example, Mike Tyson bites your ear off. It's gonna hurt. Your honey touches your ear. You have a much different experience through your entire biology. And then you find out it doesn't even have to be your ear. Same skin, same nerves, going to the same part of your brain as the pain. Rule number 3, it's not important. You can't believe where you feel it. It's not important the difference of what it feels like. The only thing you can believe at the end of the day is what you can touch and feel. And where you are specifically tender, millimeter by millimeter, is where the fascia cords and strings that go through your body are kinked and tied in a knot, or where they weave to hold you together, and many times in your lifetime, you've injured and repaired them. Rule number 4, if you examine somebody's biology that way from head to toe, the places where you are most tender overall represent the kinks in the fascia and the injuries to how you attach that happened through your lifetime that cause most of the pain of which you are conscious. Rule number 5 fascinates me. Better than 90% of the time, no matter what you think is your diagnosis, no matter how long you've had this pain, as quickly as you unkink your strings and where you need to strengthen how you anchor and hold together, the pain you thought you had will already be gone. So in a first visit, I have kind of a personal trifecta, and everything is a measurement. First measurement is, can I find your pain and show it to you? The second is, can I show you what your body needs to do to make it go away and help you understand that? And third, can we get you started doing it so some of your pain is already better before you walk out the door on your first visit, no matter how long you've had it? And most of the time, we get all three of those. And that fascinates me because, it's based on touch. And part of the problem we have in medicine is we're not taught how to touch. We're not taught how to feel. We're taught how to listen with a stethoscope. We're taught how to poke people. We're taught how to order an X-ray, an MRI scan, and a lab test. And this doesn't deal with any of that because you can't see this on an MRI scan. You can't see this on a lab test. You have to be able to feel it and touch it. And once you touch the texture in the sternocleidomastoid muscle and the upper traps, and you touch the texture over your collarbone, that texture is the same all over your body with every injury you've ever had. So you should be able to touch a person's biology and tell them where they're tender by their texture and show them where they hurt without having to ask them, where does it hurt? You should be able to show them where it comes from.
I love the 5 rules. And the first one reminds me of this experience that I had that I'd love for you to speak to it because I think it'll really help some people who are listening. So back in high school, I was a track athlete. I was a runner. I did, cross country. I did, actually 800-meter runs on the track, things of that nature. Did that for 4 years. And there are aspects of my form that probably were not anywhere near ideal. And when I went to college, I remember I hadn't ran probably in about 6 months. And I said, you know what, I want to get back into running. And I tried doing it. And very quickly, my left knee would start to hurt.
Mm-hmm.
And so I just stopped. I tried that a couple of times, eventually gave up on it, stopped running. Then I went to medical school in Arizona, tried to get back into running, left knee flared right back up, couldn't do it. Then I decided I want to try hiking, and I get into these giant mountains and I'm able to make it most of the way up. And then my knee starts to hurt, and the whole way down, my left knee is on fire. And I'm sitting there thinking, what is going on here? And in my mind went to like a worst case scenario of, did I mess my knees up that bad when I was in running? Yeah. And then the thought process was, oh, I'm going to need to get surgery and all this. And I'm like 26. I'm like, what is going on here? And a friend of mine who's a massage therapist with additional training in like fascial release and all this kind of stuff, he says to me, well, before you think about any of that, let's have a session. And he's awesome. And he brings his massage table to my house. And he's hiked all the mountains in like the southwest of the United States that are the biggest ones. And he knew that I just hiked the tallest mountain in Arizona called Mount Humphreys. And he feels my legs. And the whole session was just focused on my legs. And he says, you climbed that mountain with these legs? And I said, yeah, why? And he's like, did you get hurt? And I said, yeah, I did. But, thank God it's getting better. But he goes, okay, you've got so much, knots, you've got muscles that are compensating for the other ones. You got all this stuff going on. One session, very painful. He worked it out. And then at the end of that session, gave me some stretches to do. 2 days later, I went on a very big hike, zero pain at all. And It turned out it was like the piriformis muscle for me. For everyone like listening, is not sure what that is. Think of it on the outside, kind of to the left of the calf on the knee, all the way down to the ankle. And it's like that muscle for me was just so out of whack that he worked on that, gave me the stretches. I did one session with him a week for 5 weeks. I haven't had any pain in probably 6 years since then. I've been able to run, I've been able to hike. And there I was thinking it was my knee, and it was far from it.
Far from it. I'm looking for the diagram on these pain charts that would actually show you where that knee pain comes from. Here it is.
And if you can explain it as well for the people listening.
So this muscle in your upper thigh makes pain in your knee, and it comes down and wraps around the inside of your knee joint. And it not only causes pain in the knee, it causes the knee joint to swell. And the orthopedic surgeon thinks the swelling in the joint is coming from the joint, and not necessarily so. It can come from the fascia and the muscle doing something that we don't understand, but makes the joint swell with nothing really wrong with the joint.
Yeah, I find that amazing because there's so many people that are likely getting, unnecessary surgeries and different treatments because we're not actually getting to the root cause. And so you mentioned it a little bit earlier. Could you speak to the importance of actually getting to the root cause of pain?
Oh my God. We do so many awful things to people's bodies in the name of pain relief. We give them lots of steroids and inject them into the area of their spine. We use radio frequency ablation to kill nerves, and because we think the pain is transmitted by the nerve. But if it really was, the pain wouldn't come back after you did that. And the pain really has very little to do with the nerve. I talked about the fascia strings that go through the muscle and through the steak and hold it together. The free nerve endings in between these fascia strings, measuring friction and pressure, are 80% of the information that comes to your brain from your periphery. Not the disc, not the nerve. The free nerve endings in between the strings, helping you understand your fascia, are 80% of the information coming to your brain from your periphery. This overrules everything. We were taught about Golgi tendon organs and Pacini corpuscles and Ruffini endings, and that's 20% of the information that comes to your brain. And that's what we were taught. This other 80%, we were never taught to appreciate. So those 5 rules I gave you trump everything we were taught about pain. And you mentioned the emotional component and how you work with the mind and the spirit and so forth and so on. If I have my needle in your body releasing the kink in your fascia that's causing your pain, there's a chance you could relive the experience that made that happen. And you could end up in tears that are way more than the discomfort of the process. Those tears represent the release of everything that built up into that, that's integrated into it.
Yeah.
And so we actually have a term for that called somato-emotional release. As we release the soma, you release the emotion. You might relive the experience of that auto accident that put you there, and then you can make it resolve and go away.
Yeah. To that point, I've had friends over the years who are massage therapists, and many of them have told me experiences and I've had this personally happen twice, but people who have had certain muscles that very knotted up, and once it's released, whether it's the muscle, the fascia, whatever it is, there's a release, and then they start. For me, it was I would have like a 20 or 25 or 30 minutes laughing uncontrollably with tears coming out of my eyes. It was an enjoyable experience, but I couldn't stop. And it was this emotional release. For me, it was the psoas muscle, both sides of it, a year apart. But it was just fascinating that I've had many friends tell me who are in massage therapy for a number of years, every now and then you release something. And like you just said, people have this emotional release on the table, and they look younger after. They seem so much different.
Yes. And that's an important thing to realize, because the reaction the person's going through on your table isn't necessarily something they have any control over, isn't something they necessarily even recognize. But it's amazing to watch and see. And it happens often enough to mention.
Would this be an accurate representation of the fascia? So when I'm talking about fascia with people who don't really know what it is, the way I think about it is, okay, imagine underneath the skin, but above everything else, it's like a saran wrap kind of around the whole body from top to bottom, one continuous sheet. Would that be an accurate?
Saran wrap around every cell in the body.
Every cell.
Yes. It surrounds your organs. It surrounds the cells in your organs and holds them together. It surrounds your heart and holds it in place so it can both beat and not drift. It holds your uterus and ovaries in your pelvis. And when the fascia starts to stretch, they tend to droop and drop. You remember when we were kids, well, when I was a kid, that was the women's lib movement. And in the 60s and 70s, there were women who burned their bra. And a lot of these women who burned their bra were also joggers, which was impressive when you're a teenager. And then they found out that as they jogged and bounced up and down, the fascia that held the breast up stretched out, and the breast started to droop faster. And then came the sports bra to reinforce, so that the fascia didn't have to hold you up, but you had some clothing that would also support the fascia so it wouldn't stretch out as quickly. Maybe that's another way to understand how fascia ages.
Yeah.
Goes through.
Is there something that people can do maybe day to day in their life to reinforce and strengthen fascia? Maybe something
Not
lifestyle
really.
related or exercise
Not,
related?
not really. You know, if you have a rotator cuff tendon tear and you go to the orthopedic surgeon, they're going to send you to physical therapy for these rubber band exercises. And all those rubber band exercises can do is help the stronger muscles compensate for the weaker ones. You're not going to be able to make the weaker muscle stronger because that muscle is part of the tendon injury. And as I said before, your biology will not let you get strong enough to tear yourself apart from the inside. So if you're going to try and make the tendon stronger, you can very slowly, with a lot of pressure, massage that tendon and maybe make it stronger. But otherwise, we put a needle in it because you have that injury and you know it's injured because it's tender, but your biology does not have a clue. Your body is the ultimate orthopedic surgeon. I fixed you. I fixed you many, many times. You should be happy. And the tenderness means you weren't fixed at 100% any of those times. And so if you're going to get your body to refix this tissue, you have to wake up your healing program. In order to do that, I have to re-injure you.
Yeah.
So on the day of your needle surgery, I actually poke holes in the tendon, in the tissue, create a new injury, and then I need to put some magic in this area so that this time, when your orthopedic surgeon body goes to fix it, it counts and counts big enough that you can tell a difference at the end. And so when you skin your knee, you bleed, you make a scab, and 4 weeks later, the scab falls off and you have new skin, new blood vessels, new nerves. Your body put you back together. The skin is pink at first. It takes a couple more weeks to make the right color, but your body put yourself back together. So we take blood out of your arm, concentrate the parts of your blood that would make that scab, we call that platelet-rich plasma, and put that into the field when we create the injury. And in 4 weeks, when the scab falls out of your rotator cuff tendon, you have new strings holding you together. And that's the way the body should heal, not by cutting out the injured part and dragging it up and anchoring it to the bone, which is what rotator cuff surgery is all about, and then sending you to physical therapy to help figure it out and get things to stretch out.
Yeah.
Another issue is stretch. You've stretched your whole life, but can you think of any stretches you do that aren't pulling on the ends of your strings?
No,
For
because they're all,
example,
yeah.
if you're
Stretching.
taught to stretch your neck, you're taught to pull on the ends. If you're taught to stretch your hamstring, you bend over and reach your toes. All those stretches pull on the ends. Well, what I just showed you is that the pain comes from a knot in the middle of a shoelace. What happens when you pull on the ends?
They get tighter.
The knot gets tighter. So stretching by pulling on the ends doesn't work for what we need. So we teach people how to get their hands on their tissue and force it to stretch. We teach them how to use your skin as a handle to force the strings underneath to let go. It's an uncomfortable process, especially when that's the source of your pain. But as soon as you do it, and those strings are no longer as tight, and some of those kinks are gone, you stand up and you're already better.
Would an example then of a better way of stretching be something like either a foam roller or one of those balls that you can kind of lean into to loosen up the knot?
Nope.
Hmm.
All you can do with a foam roller and that ball, which is powerful, don't mistake, is put pressure on the knot. That's the biggest thing most people can do right away to change their pain. So I want to emphasize and bring that because it's a wonderful idea. The simplest thing you can do is grab hold of that knot where it's really tender and squeeze it as hard as you can. That's what the foam roller will do. That's what the rubber ball will do. It'll put pressure on the knots, and as quickly as that knot is physically made smaller, all the tension on all the strings in that muscle are softer. And the pressure on the nerve endings in between the strings, that's 80% of the information coming to your brain, is less. And these red speckles that I showed you on these diagrams quiet down as fast as you do that.
And if it's something that is done, maybe if you do it daily, is it something that it'll last, or does it only last for a short period of time?
Let's go to that. Let's deal with that in just a second.
Okay.
But when you roll over it with a roller and you roll over it with a ball, it doesn't stretch anything. But if you are still doing stretching, pulling on the ends, if you roll over it and you squish on those knots with the ball and with the foam roller, you will stretch better and further because the knots are already taken out of the picture to the degree you were able to make it happen. So if you use the ball before you stretch, which is what we teach, that's a great idea. But if you really want to stretch the fascia, you get your hands on the skin and use the skin as a handle. Let's talk about the answer you gave. If I put a needle into somebody's body and unlock their fascia, any needle that touches the kink in the muscle will make it unlock. An acupuncture needle, a physical therapy dry needle, a sewing needle, they'll all work. But when you use those needles, you get one knot here and one knot over there and one knot over here. When my needle goes into your muscle, its job is to take out every knot it can reach. And when my needle comes out of your muscle, you don't just have a release of a few knots, that entire muscle will be soft. Mm. And my needle has a syringe attached. And in my syringe is a gas, not a liquid. And with a gas in the middle of that glued together ropey band of fibers, I can open that up and separate the glued together strings of fascia. That restores blood flow to the middle of that muscle that it hasn't seen in a long time. And for the professional athlete, that means you're not going to bonk as fast because the muscle is getting blood flow. And the second thing it does is it allows the strings to adjust themselves to some degree. If your pain comes back, there's only 3 reasons for that. Reason number 1, if you glue right back together and all your pain comes back in 24 to 48 hours, it is almost always your food. It could be environmental poisons, it could be Lyme or mold, but almost always it's your food. Second, I unkinked the muscle. I did not unkink its anchor. They pull against each other for 2 or 3 weeks. Some of the kinks will come out of the anchor and some will go back into the muscle. And you'll come back on your next visit and say, some of my pain came back. I'll say, let's do it again. You'll get to a higher level until reason number 3. This anchor isn't strong enough to hold you. And just walking around and climbing up the mountain like you were doing, you put enough force on this to tear it and kink again. And that's why the pain came back as you were going up and down the mountain, is you were loose enough to get started, but you weren't ahead of that enough. And your injuries to how your fascia in your thigh holds together weren't strong enough at that point. And you were right on the cusp, a little bit out of pain, right back into it. And what your friend was able to do was to get your kinks out enough that you have enough room to tighten that you can make the hike and come back before you're tight enough to hurt again.
Given the explanation that you just so beautifully spoke about, is this one of the reasons why, as it relates to pain, massage therapy can be so useful if the person knows what they're doing and they're getting the kinks out with their hands?
Absolutely. And that's why we stretch. Football players stretch before practice to create room for the tightening that's going to happen. So you can tighten some before the pain starts. And they stretch during practice. And then they might stretch again after practice to make up for what they just did. So for us, it's much more effective to use that rubber ball and the foam roller because you can really put a lot of pressure right on the kinks and really shut them down. But don't mistake, the foam roller and the ball don't really stretch anything.
Yeah. Something that I think is really important to bring up. I think so many of us, we have this negative connotation to pain. And so we kind of misunderstand it. We think it's a bad thing and we do what we can to eliminate it as quickly as possible, which might lead to, using whether it's a pharmaceutical or a treatment that is not actually addressing the root cause, but it does get you out of pain, seemingly your felt experience of it in the moment. But, just like in the emotional side of things, when I'm working with people, if there's pain coming up, if there's emotion coming up, it's coming up to come out. And when we suppress it back down again, you're not allowing the body to release it. So it's going to do some damage. It's going to accumulate. And so you find that as well, that people typically misunderstand that pain is more of a signal that, hey, something's going on, you should pay attention, versus let's try to numb it and forget about it.
There are so many places to go with your last paragraph, but let's go to this one first. You're absolutely right. We're taught to sugarcoat and powder puff our injuries and our pain. We're taught ice, rest, elevation, Nuprin, Motrin, all those things to decrease the inflammation. And they are so totally the wrong thing to do. Let's talk about it for just a second. If you sprain your ankle, what do? You put ice on it? Do you put heat on it? Do you alternate ice and heat? And that goes right to your question. So we're taught to put ice on it because ice can make it numb. We're taught ice will reduce inflammation. When you create an injury in your body, you have 48 hours to set the tone for healing for the next 6 months. And there's a study that was done that I quote all the time that was actually misinterpreted. But the study was taking 100 Army recruits that had ankle sprains, and half of them got a drug called meloxicam, which is a strong anti-inflammatory drug like Motrin, Nuprin, Advil, the whole family. And the other half didn't get that drug. Well, the half that got the drug got back to work faster, had less swelling, had less pain, had their injury sugar-coated, but 6 months later still had an unstable ankle that hadn't healed. When you sprain your ankle, wouldn't you think that our biology has been around maybe thousands of years, maybe a couple 100,000 years, maybe 6,000 years, depends who you read, right?
Yeah.
But if you get the idea and you combine that with a little bit of survival of the fittest and the evolutionary principles we were taught, don't you think that those of us that had a biology that was able to repair that ankle better lived to survive? And those of us who didn't repair that ankle as fast got eaten?
Yeah.
So over time, our body learned how to repair an ankle sprain as best as it could without medicine, without any extra help, right?
Mm-hmm.
So what does your body do when you sprain your ankle? Does it warm it up or does it cool it down?
Warms it up.
Right. Why does it warm it up? And I'm going to tell you to speed up metabolism, to speed up blood flow, and to speed up healing. Why would you ever want to slow that down for even 5 minutes? Don't put ice on any wound, ever. You go home and you augment your body's ability to heat it up, and you put heat on that sprained ankle. And you prop it up in the air, and you massage the swelling out with your hands, not just squeeze it out with an ace wrap. And it hurts and it's painful to do that, but it works. And in 3 days, you'll be able to walk on that ankle. And if you put ice on it, you stopped the healing response, and you can never recover what you lost in that first 48 hours.
That's
You don't ever use Motrin you take Motrin after your tennis game because your shoulder hurts. You just stopped your body from healing the injuries you just created. It's not a good idea. It's not your friend. You go home and put heat on that shoulder. And you go see the massage therapist to take the kinks out. And if the kinks coming back, you come to see me to reinstall or restore the integrity of your fascia and show you what to do with it. And that's how you keep the pain to go away. And that's how you get your body to heal.
And what you just shared is so incredible, because for so many people listening, it probably sounds so opposite to what they were told at various points in their life. And that's why, there's so much value in what Dr. Blatman is sharing, because you hear this and you say, oh my God, potentially I've been doing this wrong the entire time. And now I can start making new choices today. And so in your experience, Dr. Blatman, what have you found to be the most effective forms of treating pain? You mentioned platelet-rich plasma before. What else have you found to be effective?
No, what we need to do is we need to believe that the places where we're tender, that's important and that's meaningful. And what we need to do is make the tender things not tender. So if you remember, rule number 4 is the places that are most tender make most of the pain. So how would you figure out if the pain in the bottom of your foot came from your plantar fascia strings, which are, let's see, this?
So right below the toes. Yeah.
Right below the toes, the plantar fascia, the bottom of your foot, makes this pain. Or, pardon me while I flip this over. If the pain you feel in the bottom of your foot comes from the really tight kink and really tender kink in the back of your calf muscle. And the answer is rule number 4. Where are you most tender? Make the most tender thing go away. So if you touch the bottom of your foot and it doesn't really sing to you, and you touch the back of your calf and it lights up and is really tender, you need to unkink the strings in the calf. And as fast as you do that, you won't have pain in your foot anymore.
So get what you just said, given our conversation earlier, is it fair to say that if you have the foam roller, if you have that ball and you're home right now and you're listening to this and you know where that most tender spot is, if you can really lean into that and you can get it to shrink, like you said, you would at least have some temporary pain relief at that
Correct.
point.
And that would last until that knot tightened back up again, which would give you a clue that you're on the right track. You had pain in your knee walking up and down the mountain because your thigh muscle sends pain to the knee. The thigh muscle makes you think that there's pain in your knee. You know, there's another one. How about phantom limb pain?
Yeah, I was talking about that earlier with somebody. Yeah.
Well, phantom limb pain, we're taught, is central. Your brain seems to remember there's a foot there and kind of makes pain go there. That's another one of our thought processes that belongs in the horse poop drawer.
If you can explain to people listening what phantom limb pain is, if they're not sure.
Okay, so how do we do a BK amputation? BK means below the knee amputation. So we're going to take a saw and cut the bones below your knee. So you still have some leg bones, but you only have a few inches of them, maybe 5 inches. And then we're going to take the muscles behind the calf and we're going to bring them around to the front and tack them to the front of the residual leg bone that we call the tibia. And that creates, so you have skin on the outside, then fat, then muscle before you get to the stump of the bone. And you even take a file and you smooth the edges of that bone before you tie all that back together. But the muscle in the calf is still present. And the muscle was injured when the leg was injured, which is the reason it's getting amputated. And if you remember from the picture I just showed you, the muscle in the calf sends pain to the foot. And the muscle in the calf doesn't care there's no foot there.
Wow.
And it's the muscle in the calf that makes the brain think that the foot still hurts. And as quickly as you unkink the strings in the residual stump, the foot pain is gone and has nothing to do with your brain, with phantom, with making it up, with anything.
That's so fascinating because I was listening to, I was watching this video earlier today, but I've seen it years ago. But the idea was that if you were to take this divider and put this fake like left arm down, let's say, and now you couldn't see your real left arm, and then they're able to kind of trick the brain, at least the way that the video is shown, to believe that the fake hand is really your hand. And you can, they can do things to the fake hand and you feel it in the real hand. And there was a physician, I don't remember his name, but he had something similar where he had patients who had what he called phantom limb pain. And again, for people listening, it's like you don't have a left arm, but your left arm hurts.
Right.
And you're sitting there thinking, what am I supposed to do with this? Because I don't have an arm, but my arm hurts. And the way he at least treated it, it was, I think, using mirrors. It was like convincing the brain, but that was fascinating to me. So if I'm hearing you right, in this example, the person does not have, let's say, a left foot because they're below the knee has been amputated, but in what they're feeling is their left foot hurts, but it's not because like the brain's sending some signal down. It's because the left calf is sending a signal.
Correct.
Yeah, that's amazing.
Same thing with above knee amputations. I have a patient who's an AK, above the knee. When we take the kinks out of the stump in his thigh muscle, his foot pain is gone, his knee pain is gone. He feels normal again. And that lasts until you tighten back up and re-kink. It's fascinating that mirror thing really also does work.
Yeah.
But if you remember, the only thing you can believe at the end of the day is what you can touch and feel. It's very concrete for people. Make the tender things not tender. And as fast as you do that, the pain goes away. And
I love that.
That trumps everything else we've been taught.
I love that because it applies across the board, because in the mental emotional side as well, the tender things, another way of saying it is the emotional triggers, like the things that bother you. Right. As quickly as you can make those, like it's not a trigger anymore, it doesn't bother you anymore. The release that you experience of the emotional pain, the release that you experience of all this unwanted, undesired feelings that you're experiencing, they go away. But if you ignore them, if you bury them, if you medicate them, they're still there.
They're still there. And the medicine doesn't work. Yeah. You know, we use the medicine Lyrica and Neurontin for pain. Doctors are now taught, don't use opiates. Opiates are probably the most effective drug for pain and the most benign drug for pain. Unless you get high doses and you end up on the path of addiction and so forth, which is not such a good thing, these drugs are not harmful. You take an anti-inflammatory medication for your pain. It does things you don't want done to your body that nobody tells you. For example, ulcers, that's one. A lot of people are familiar with the stomach hurt that comes from too much aspirin and Motrin. Second one is kidney failure. A nephrologist once told me he's seen more people on dialysis from Advil than from diabetes.
Wow, that's powerful.
That's profound.
Mm-hmm.
Number three, it stops you from growing cartilage to repair your daily wear and tear in every joint in your body. And number four, the drug causes heart attacks. Why are you signing up for that? And when it comes to cartilage, we're taught that you're born with amount of cartilage and you wear it out with time, and then you got to replace your joint because there's nothing else to do. That also belongs in the horse poop drawer. The orthopedic textbooks say you don't grow cartilage, but think about it for a minute. You grow new skin every 7 to 10 days. You can grow new bone. You can grow new brain cells. You can grow new hair. Does it make any sense that our biology can't repair joint cartilage from daily wear and tear?
No.
No. So we grow cartilage in every joint, every minute of every day, unless we take non-steroidal anti-inflammatory drugs or have nicotine in our blood. So if you want to restore your joint, stop taking those drugs that they give you for pain and take the cigarettes away. And then you can do things to help your cartilage restore, because you absolutely can grow new cartilage in a worn out joint. And while we're on the topic, you go to the doctor, you complain of knee pain, just like you had. There was nothing wrong with your knee. It was your thigh muscle. Your doctor takes an x-ray, shows that the bones are too close together, tells you you've got bone on bone and you need a new knee. That's the rub, right?
I've heard that so many times from people. Yeah.
Yes. If you can totally straighten your knee and you can bend your knee a little more than 90 degrees, there is no possible way that that joint is bone on bone.
Yep. Yeah.
All you need is 2 cell layers of cartilage to get a joint to move. It takes a microscope to see a cell. So those bones are going to look really close together. But if you can still move that, then you have enough cartilage to restore your joint most of the time. That's fascinating.
Yeah, and it's also so hopeful for people listening, because I've heard people throughout my life, I have a very big medical family, a lot of physicians, and the amount of times I've heard the story, the bone on bone, and then the knee replacements. And then after the fact, people will tell me that they already had gotten it. And there were things that, people like yourself that I know that I could send them to. It's like, hey, you didn't need that, more than likely. There may be some situations where they do, but in general, it's not the first resort.
You release the fascia that's causing the problem in the thigh muscle, and you restore the cartilage at the same time. You do both for people, and they can restore their biology.
Yeah. And so before we shift into the latter half of our conversation, is there anything else around pain that you'd like to share today, or do you feel that you've covered what you'd like to cover?
I think we've covered a lot, but I'll reserve the right to go back.
Perfect.
We bring up something as we're going that strikes something in my head, goes, oh, we really missed that. We want to, how about scoliosis?
Sure.
What is the cause of scoliosis and how do you make it change? And I'll tell you that scoliosis is caused by fascia. The strings go longitudinally along the body, but they also wrap around. And if you examine the body's fascia, we have deep and shallow lines up our front, deep and shallow lines down our sides, deep and shallow lines down our back, and then spiral lines across the middle of our trunk. That's so we can move and so we know where our body is in space. But what happens when a child is trying to grow vertically and the fascia doesn't release or pathologically contracts, like in Dupuytren's contracture when the hand turns into a claw? The spine can no longer grow vertically. So it grows in the path of least resistance, and that is a spiral. So scoliosis is not an S curve, it's a spiral. And so what we've learned to do is to be able to feel the tight cords and strings that bind the child and prevent vertical growth and release them. And as quickly as we can do that, we can watch the child unwind, spring up, and grow taller. Sometimes 3/4 of an inch in a period of 3 days.
Wow, that's
So we can
amazing.
actually reverse the curve of the scoliosis, especially if we get the child young enough that their bones haven't deformed yet. And that's the bony deformity that happens as you're 16, 17, and 18. The spinal bones become a trapezoid in both directions, like the steps of a spiral staircase. And that's really difficult to undo. So if I get you before that and I can release the strings, you can grow up without the curve if I can release enough of them. And that helps explain why braces can't work. Because scoliosis is an inside job, not an outside job. And it's not a muscle imbalance. It's a tug of war of your fascia that you can't possibly win.
Mm.
You have to release it from the inside.
So it makes a lot of sense about, if you can get the child when they're very young. Now, if somebody's older, like you said, it's much more difficult. Is it still possible to either reduce the pain dramatically by treating the fascia and or
Absolutely.
cure?
Absolutely. You can reduce the pain, but you're not going to be able to undeform the bones.
Yeah.
In order to undeform the bones, you have to put the same pressure for the same length of time in the opposite direction. So you need to hang from your feet for years.
A little bit more challenging. Yeah.
A bit more challenging, but it could work.
Yeah.
Because you're putting pressure on the bones in the opposite direction, and they will tend to go back to what they should be.
It's amazing too, because when you get the child when they're young, you're using what the body's going to be doing anyway, the growth process, to like support the healing of it, which is so cool.
Yes.
Yeah.
Very much. Okay. That came up. Let's see what
that's perfect. You continue to reserve the right. And so the foundation of this podcast and of my work is to help people create an extraordinary life without regret. Given the way you see the world, given your life experience, how would you advise someone to do that, to create an extraordinary life without regret?
Oh, wow. Follow your dreams and follow your heart. Really, I think that's important. You don't ever want to turn around when you're 80 years old or 90 years old and go, I wonder if I could have.
Yeah.
I wonder if I could have, or I could have done that if only. You know what? Get up and do it. Get up and do it to the best of your possible ability, because I want to know when I'm 80 and 90 and 100 years old, if I last that long, that I gave it my all and it either worked or it didn't work.
Yeah.
You got to give it a chance.
Yeah, it reminds me of Dr. Wayne Dyer. There's a quote I heard from him years ago: "Don't die with your music still in you."
There you go.
And that has spoken to me so immensely. And everyone listening, you've got that music in you, that it's like your own unique music that you can hear. And through your actions, through your creations in the world, you can share that music with all of us to benefit from, because you got something on your heart that's there for a reason. And it can help the people around you immensely. But if you're afraid, if you're living from that fearful space and you're in doubt and you're not willing to share it, then there's something I heard from Les Brown. He's a motivational speaker, still alive now, but he was really big in the 80s and the 90s. And something to the extent of, the richest place in the world is the graveyard, because that's the place where so many people's hopes and dreams remain. It's like, that's where all of the change, like, all the cures, things that we were looking for now, they were in people's hearts and minds, but they didn't share them. And so what could be different? Like Dr. Blatman said, follow your heart, follow your excitement, follow your calling. And again, you can always go back and do what you're doing now, but something tells me that you're not going to want to.
And try to not do anything you don't like to do. Can you find another way to do it so it becomes, more fun? Can you give it to somebody else to do so that you don't have to do it? Lots of ways to make your life rounder for what you need. And for God's sakes, don't be stuck doing things that you're really unhappy with.
Yeah.
If you can find an ability to do the things that you love most all the time, you never have to work a day in your life. And that's a lot of fun.
Yeah, absolutely. And I think a great secondary aspect to this question is, if you were in your final moments and this was your last opportunity to share and help anyone listening, what would you want to make sure they knew? What would be that important?
Oh my. I think I would put everything we've talked about so far today,
Mm,
because I think it's so important. People really need to know you don't have to suffer, you don't have to be in pain. And they need to change the parts of their life that make the pain happen. And for many people in chronic pain, it's your food. Anybody in chronic pain, I would categorically say, maybe not 100% of the time, but pretty close. Half of your pain goes away in 4 to 6 weeks by changing your food, like it
mm,
was never there in the first place. That's huge. And we feed people food that causes pain, causes disease. And as you come to my office and learn this, and you take the foods out, we have a do not eat list. Take the foods out that cause the pain. Pain does not fall down from the sky. If you wake up in pain you didn't have last night when you went to bed, it's almost always last night's food. If you go to bed in pain you didn't have this morning, it's almost always breakfast or lunch. You wake up with a stiff neck, it's not a pinched nerve. It wasn't the window, it wasn't the pillow, and you don't sleep that wrong unless you have Ehlers-Danlos syndrome. It was the food you ate last night that glued the injuries through your lifetime together, and your kinks in your neck and shoulder muscles all glued together, and you woke up with that. And you go to your healing professional. Wasn't they wonderful? They worked on my body and my stiff neck was gone. My pinched nerve was gone in 3 weeks. And I'm going to tell you that the inflammatory reaction from the pizza was 3 weeks long. And your professional didn't make any difference except to touch you.
wow. It's amazing because, and it ties in so beautifully with our conversation so thus far, this idea that, pain is a signal, it's a symptom that something deeper is going on. And in that same kind of way, everyone listening has had the experience of eating a food or drinking something that doesn't agree with your body. You eat it, you drink it, and there's a reaction, whether it's bloating and gas, whether it's, there's constipation or there's diarrhea, whether there's a headache, there's brain fog, something's going on. That is a signal. Your body is not liking this. Your body's reacting to it. And very often, I know many people, they ignore that. And by ignoring it, they keep doing it, and they chalk it up to, I like this food, I really enjoy it. And yeah, so it messes my body up for a couple of days. And they like kind of live with it, which is a choice. Everyone's free to do what they want to do. But recognizing that you're creating this inflammatory cascade in the body, an immunological system that getting activated unnecessarily. And yeah, it gets very unfortunate to see that we ignore the symptoms and signals that our body gives us so often.
And what happens is you went and offended your body and your body sent you to your room.
Yeah.
You've been sent to your room. You've been given a timeout in pain. Your job is to go and figure out why you're there and not do it again. And if you're true to that, my God, the rewards are huge. Do you know how lucky you are if you realize that your food causes your pain and you avoid those foods that cause the pain? Because the foods that cause the pain are also the same foods that cause rheumatoid arthritis, heart disease, dementia, and the chronic and cancer, the chronic diseases of our lifetime. So if you avoid the foods that cause pain, you also avoid the foods that cause disease and wear your body out and lose your resilience.
Yeah, I often tell people, tune in, kind of like I was alluding to before, but tune in when you eat something, the minutes, hours, and days, at least 2 to 3 days after, how do you feel? If you eat food and you get that kind of stereotypical Thanksgiving, I am exhausted after I ate this and I feel like I need to take a nap. Food's supposed to be giving, why are you eating? You're eating to get energy. So why are you exhausted? Why do you have all the brain fog and the symptoms and the bloating? Because your body doesn't want to be eating this.
We actually eat for two reasons.
Mm,
One is to get fuel to burn. So what level of octane are you putting in your body?
yep.
And if you put in low octane fuel, you're not going to go around the circle like the big boys.
Yeah.
And the other reason you eat is to get raw materials to build new parts.
Yes.
So what are you building your parts out of? Garbage, or that isn't going to hold together and isn't going to work? Or things that are not compatible with your biology, like hydrogenated fat?
Mm-hmm.
Or are you building your body with parts that can hold up and stand the test of time, that put you together and help you heal?
Yeah, something with that is so beautiful. I was just mentioning this on a podcast I did recently. My understanding is that you alluded to it earlier about the bones and the skin. The body's consistently turning over. Now, the old research that I saw, this is years ago, like 10 years ago probably, was saying every 7 to 10, every 3 to 10 years, your body's basically brand new. But I've actually heard it more recently that it's about a year,
Oh,
and
wow.
a new skeleton, new everything. And with that in mind, like Dr. Blatman just so wonderfully said, what you're putting into your body is what your body is using to rebuild your body. And so if you're sitting there thinking, okay, here's these foods that I'm eating, and I'm thinking it's no big deal, I'm thinking it's not actually impacting me. Yeah, I don't feel too good after I eat it, but I kind of brush it off. That pizza, that whatever that you're reacting to, fast forward a week, a month, a year, that's part of your skin, that's part of your heart, that's part of your skeleton.
Mhm.
And you're putting in like the suboptimal building blocks, and then things break down over time.
Exactly right. And so the higher quality of what you put in, the more you're going to get out of your body. Everybody's heard you are what you eat. But what people don't realize is how the minutia and the details count. For example, you touch your upper traps, the muscle that goes across the top of your shoulders, you give that a squeeze. In most people, it's tender, it's tight, it's ropey.
Mhm.
Well, you're tender and you're ropey because of the injuries through your lifetime of lifting and carrying that we talked about at the beginning. But the reason those fascia springs are glued together, stuck together and tender, is what your immune system does to your fascia when you eat dairy from cow. And people go, well, I don't eat much dairy, or I only have a little bit of butter, right? But this is an immune system reaction. If your immune system is sensitive to bee stings, how many bee stings does it take to kill you?
Very few.
Not even one, a part of one. That's how much butter you get before this muscle locks up and glues together. So it's zero. If you're going to feel good, you don't touch this food. So then we look at what causes food cravings, right? Because the reason you're still eating that donut is because somehow you crave the donut and you're willing to put up with the pain that it's going to cause you for the next 4 weeks. Well, when you choose your food, you're not the only one that's making the decision. You're not the only one who lives in your body that eats that food. And what you're telling me is you run your body as a democracy. And when you think you're choosing your food, all the critters that live inside you are also voting. And there's way more of them than there is of you. So you can go down the buffet line, put all the rabbit food on your tray, reach for your wallet to pay your bill, and the critters in your belly, your brain, and all over go, excuse me, what are you doing? Go, well, I'm paying for my rabbit food. Oh, no, you're not. You forgot the cheesecake. I'm not eating cheesecake. I'm just eating. No, you are eating cheesecake. You go back and get it now. And you'll get out of line and go back and get the cheesecake. And everybody has had that experience at one point or another. And that doesn't change until you change your political construct. And instead of being a democracy, you run your body as a benevolent dictatorship. You look in the mirror every morning and say, I love me. So you know you're worth fixing. And then you decide who in your body is going to eat today besides you and stop feeding the bad guys.
Yeah.
So what happens in our political universe? We see it every day. We get the world news every single day. What happens when you kill your political opposition, put them in jail, or exile them? The bottom line is they stop voting. And now you go down the buffet line and you find out what you like without that other input. And you put the food you want on the tray, and there's no voice in your ear telling you to go back and get the cheesecake. Mm-hmm. But it takes a few weeks of benevolent dictatorship to pull that off. So what I've had to do is make a deal with my lips, because I'm incredibly sensitive to these foods. That's how I learned it. And then I found out it's like everybody's this way. There's not one person in chronic pain that isn't dramatically affected by what they eat. Mm-hmm. And so that's how I learned it. I kind of lost my train of thought.
No, it's completely okay. And if I can jump in then, for just everyone listening, if there's any message that you take from this, I think it's what Dr. Blatman said earlier. You don't have to stay in pain. You don't have to be suffering. There is another way, especially, or not especially, but very likely not the way that you've been taught, not the way you're familiar with. And someone like Dr. Blatman he can really support you in that. And so as we wrap up, Dr. Blatman, the
I
question
wrote a
always,
book. I wrote a book. It's called Winner's Guide to Pain Relief. And this book describes how fascia goes through your body. It shows you the pain patterns that come from your muscles and your trigger points. It shows you how to use the rubber ball. And pull up a picture. Oh, here we go. How to use the rubber ball that we were talking about earlier for all the various muscles in your body and where they're important. And then for pulling on the ends, we do teach how to do stretches, even how to fix carpal tunnel syndrome. And then at the very end of the book is a picture index. So you can actually open up the index, look for your pain pattern, and go in the book to where that pain is and learn how to make it go away. And you can figure a lot of that out for the do-it-yourselfer, the book and the ball. You can figure a lot of this out on your own, the same way we did it.
And where can people get that book?
You can get it from our website, blatmanhealthandwellness.com. You can call our office in Cincinnati, Ohio. We can send it. If you're in New York, we have some there. You can order it on Amazon. I actually saw it for $80 on Amazon, believe it or not. But Amazon doesn't send you the ball. So go to our website, www.blatmanhealthandwellness.com. You can order the book there. You can order some body working tools. And there's a tremendous amount of information to read to help understand your body, your pain, various things of what goes on with your body that we're just not equipped to handle in conventional medicine.
That's wonderful. I'm going to be picking up that book right after this conversation. And so I hope everyone else does as well. And I feel like this is a wonderful spot to wrap up. And so we just love to ask you, besides what you've just shared, are there any other ways our listeners can contact you, whether they want to learn more about what you do, whether they want to work with you, anything like that?
I have an office in Manhattan. I'm there every Thursday and Friday. I have an office in Cincinnati. I'm there Monday, Tuesday, and Wednesday. I would go to our main website, blatmanhealthandwellness.com, and read and learn, contact. I have YouTube videos that explain a lot of this about pain, especially that you can grow cartilage in a joint. I have an Instagram channel you can learn and sign and follow. We do some Instagram live things here and there. The office also has a Facebook page. So tie into us, become part of our community, learn all these things that we're trying to share and help you make your life better.
Wonderful. I will have all the links that Dr. Blatman was just referring to in the show notes, so they're easily clickable and you can find out everything that he's up to and how he can best support you. And if this conversation resonated with you, if it supported you, first and foremost, please share it with people that you know to help them get out of pain. There's so much that was shared today that can make a massive difference in somebody's life. It can literally be a life-saving thing to share this with somebody. And if you can please leave a review, whether it's on Apple or Spotify, it really does help and it gets the message out better. And before we close, is there anything else you'd like to share, Dr. Blatman?
We're here to change medicine. We're here to make a difference. We're here to help people. And what we were taught is not the way our body works and not the way we're put together. And so as we expand and we learn all these other new tools and everything that we've learned after school, gosh, we can really help.
Absolutely. It's like what we said at the beginning before we started the recording, the learning never stops. Wonderful. And so for everyone listening, like I said in the beginning, my life's work is to help leaders, champions, and high performers to experience more happiness, peace, and fulfillment as they create an extraordinary life without regret. If you'd like to have a conversation to see if I can support you towards either shifting out of a challenging situation that you're in or building that dream in 10 months rather than 10 years, I'd love to have that conversation with you. You can schedule it on my website at jamilsayed.com. And you can also check me out on my social media at Dr. Jamil Sayed, which is DR and then my name on Instagram, and then at Jamil Sayed on Facebook and LinkedIn. There's about 850-ish pieces of content, all free. It's helped a lot of people over the years, and I'm sure it'll support you on your journey as well. I'll have the links in addition to everything Dr. Blatman shared in the show notes below. Thank you again so much for being here, Dr. Blatman. Thank you everyone for tuning in, your time, your energy, your attention. It's the greatest gift you could give, and I don't take that lightly, and I'm sure Dr. Blatman doesn't as well. This podcast name is Transformation Starts Today, and I called it that because I found that most people's favorite day to change their life is tomorrow, and that's why they stay stuck. But you can be different. You can get Dr. Blatman's book. You can listen to the exercises we talked about, and you can start getting yourself out of pain. You can realize, you know what, I'm not happy with the way that I'm living right now. And you can make the change in the only time you can make it, which is the present, which is right now. And then your life will change before your very eyes. Sending you all so much love and wishing you the best. Create a meaningful day and rest of your week.
Amen.
Thank you for being with us today. If this conversation served you, it would mean a lot if you left a review and shared this with anyone who may benefit. An extraordinary life without regret is available to you now. Choose it. It's your time.